Hello, my name is Juan Luna. This presentation examines healthcare workforce burnout and retention as a major challenge facing healthcare leaders. I will describe the challenge, explain the types of decisions leaders make to address it, and discuss why transformational leadership is an effective model for creating lasting improvement. Healthcare workforce burnout is more than normal job-related stress. It can involve emotional exhaustion, detachment from work or patients, and a reduced sense of effectiveness. In healthcare settings, burnout is often influenced by high workload demands, staffing shortages, administrative responsibilities, limited resources, and a lack of control over workplace conditions. Healthcare leaders must address burnout because it can influence both workforce outcomes and patient outcomes. A systematic review and meta-analysis by Liu and colleagues found that nurse burnout was associated with poor patient safety outcome, lower quality of care, and lower patient satisfaction. The review identified relationships between burnout and missed nursing care, medication errors, patient fails, and infections. These findings do not mean that burnout is the only cause of these outcomes. However, they demonstrate that burnout creates meaningful risks for patients and organizations. Therefore, reducing burnout is not only an employee wellness issue, it is also a patient safety quality improvement and organizational performance priority. Healthcare leaders make several types of decisions when addressing workforce burnout. First, leaders make strategic decisions by establishing priorities and measurable outcomes. For example, a leader may set goals to reduce turnover, decrease overtime, improve engagement scores, or improve patient safety measures. Second, leaders make operational decisions involving staff levels, schedules, workflow, communication, and workload distribution. Leaders may need to review whether employees have appropriate staffing support or whether unnecessary administrative tasks can be reduced. Third, leaders make final decisions. Resources may need to be allocated towards retention programs, training, staffing improvements, employee assistance resources, or technology that reduces administration burden. Leaders must also make ethical decisions by balancing the organization's financial limits with employees' well-being and safe patient care. Finally, collaborative decisions are essential because frontline employees have firsthand knowledge of barriers that contribute to burnout. Leaders should begin by collecting data rather than assuming they understand the cause of burnout. Important indicators include turnovers, vacancies, overtime, sick time, employee engagement results, exit interview themes, and patient safety data. This information can help leaders identify units or roles experiencing the most strain. Leaders should also create safe and confidential ways for employees to share feedback. Employees should be included in developing solutions because they understand the daily realities of workload and workflow barriers. Potential actions include improving staffing plans, increasing schedule flexibility, reducing unnecessary administrative work, providing peer support, and offering coaching or well-being resources. A systematic review by Cohen and colleagues found the workplace interventions can improve well-being, engagement, and resilience while reducing burnout among healthcare professionals. Effective interventions are not one-time events. Leaders should monitor results and adjust strategies based on staff feedback and organizational data. The leadership model that best fits the challenge of workforce burnout and retention is transformational leadership. Transformational leaders create a shared vision, motivate employees, encourage collaboration, and support professional growth. This model is appropriate because burnout is a complex issue that requires long-term culture change rather than a quick or isolated solution. Transformational leaders help employees understand how their work contributes to the organization's mission. They also encourage staff members to communicate concerns, suggest improvements, and participate in decisions that affect their work. Individualized consideration is especially important because employees may have different stressors, professional needs, and level of support. A literature review by Pledis and colleagues found that transformational leaders may help reduce workplace burnout by supporting employee involvement, positive work relationships, and recovery opportunities. Transformational leadership is a strong fit because no single leader can solve workforce burnout alone. Leaders need employees to communicate openly about workload problems, safety concerns, and barriers to developing quality care. By creating trust and encouraging staff participation, transformational leaders can help employees feel respected, supported, and connected to the organization's purpose. Teamwork is also an important factor. Val and colleagues found that the stronger teamwork was associated with lower burnout among hospital staff at both the individual and unit levels. This supports the idea that leaders should build a work culture where employees collaborate, communicate effectively, and share responsibility for improvement. Success should be measured through workforce and patient outcomes. Important indicators include lower turnover, less overtime, higher engagement, better patient safety results, and improved patient satisfaction. Transformational leadership supports these goals by strengthening relationships, communication, and shared accountability. These scholarly sources support the connection between healthcare workforce burnout, patient safety, workplace interventions, transformational leadership, and teamwork. The presentation uses APA 7th edition style and text citations on the relevant